Our next speaker is Dr. Whelan from the Joint Research Center at the European Commission, and as Dr. Knight pointed out, he'll be answering any questions that Dr. Knight didn't have a chance to answer.
Okay. Yes, Derek, I'll be remembering that for the next time. Okay. So thank you very much. It's a great pleasure to be here to address you. I'd like to thank the Academy and the sponsors, and particularly the organisers, for giving me this invitation. You know, when I arrived this morning, I was told to go to my coffee break. I should go down the corridor and turn left at Darwin. So I realised I must be in a place where there's a lot of history, so I appreciate that. So I'm from the European Commission's Joint Research Centre. It's the in-house science service of the European Commission, and our job is really to provide hopefully robust and impartial scientific advice to policymakers. My institute, the Institute for Health and Consumer Protection, supports an array of different policy areas, and also a number of kind of emerging and cross-cutting issues. I'll talk briefly about a couple of these, but just to give you a flavour of you know, what challenges are facing in Europe. You know, in the cosmetics, we actually have a ban coming into force from January 2013 that we can't use animal testing for evaluation of the safety of cosmetic ingredients. This is a €60 billion business in Europe, some of the biggest companies in the world in it, and so we're really at the coalface now of trying to find solutions for this. I'll mention a little bit about the endocrine disruptors and also combination effects of chemicals also being drivers. But recently too, besides just in the cosmetic sector, we've have the new directive on the use of animals for scientific purposes, which comes into force in January 2013, which again restricts the use of animal testing. So it's a major driver. I just wanted to mention ECFAM, that through this new directive had its mandate broadened, and if you notice in the name, the word validation has been dropped, not because validation isn't important, of course it is, but our efforts really have been broadened now to try to guide the development, the smart development of alternative methods in vitro and silico, integrated testing strategies, how to use those components together, and also to really demonstrate and facilitate the use of these methods in a regulatory arena. So this is what I'm going to talk to you about today. First of all, just to give you a little flavour about, particularly in the EU, what are the drivers currently really pushing us towards a systems biology-based paradigm. You know, what paradigm am I talking about, and why do we need to shift it? And how do we capture the knowledge that we need that underpins this knowledge-based paradigm? And give you a little flavour of how we might apply this. I mean, I'm conscious I'm pulling up short of what the expectations possibly from the session organisers were in maybe presenting some concrete examples, but the truth of it is in Europe we don't have very many case studies of actually the use of systems biology and related data in risk assessment decision making, but I hope to show you how we think we're going to be able to do that, so if I'm ever invited back in the future I might be able to show you something very concrete. So I just came from Brussels to here, and this was a conference being organised by the European Commission. I was involved in it, to really discuss the whole issue of endocrine disruptors. So you might say, well, you know, what's new? Well, in fact, Linda Birnbaum from NIEHS gave the keynote. We had a lot of prominent folks from over here talking there, which I thought was very, very welcome, because it is definitely a global issue. But what's facing us in Europe is much more now than a kind of a general concern. But in fact, in many pieces of legislation, we've already foreseen the risk management of endocrine disruptors. And what's missing is, although we have definitions of endocrine disruptor, like from WHO in 2002, they're too vague for regulatory implementation. So we have to come up with specific criteria that will allow us actually implement the provisions that are already in our legislation. And the desire politically is to come up with one set of specific criteria that would be linked, for example, to actual test methods, that would be applicable across all these regulatory domains. And by the way, could you do that by 2013? So we've got, I don't know what 2013 has, and I must see what the historic relevance of 2013 is. But anyway, so we're faced with this very, very practical challenge of formulating criteria that says what an endocrine disruptor is or not. Now, I just pulled up this slide, one of the presentations made there by Andreas Kortenkamp, who actually wrote the State of the Science report that was commissioned by the European Commission. It's freely available online. That's created a lot of, call it discussion, let's say, at the moment, because not only was it a review of the state of the science, but it then went on to actually begin to formulate what these criteria might look like. If I just jump to, let's say, the recommendations are from his presentation, but sum it up, is basically criteria that are going to be required for defining adversity and mode of action. So it's foreseen that the illustration of mode of action is going to be a regulatory requirement in this context. It's not a just nice to have. And the other major discussion point is this abandoning of potency. That as it's expressed in the legislation at the moment, it's very much a hazard categorization, so it would be similar to a CMR. But of course, a lot of parties would find that uncomfortable to deal with because it could be potentially very practically implemented. But what happened at the conference, as ever, is that the low dose discussion came up again. And as I said, Linda Birnbaum and Jerry Heindel from NIEHS were quite vocal on this. And others. And I'd really hit home again to me that there comes a point where you can't really deal properly with those discussions unless you really begin to understand the system of biology. That just discussing observations made through animal tests and so on, it's just simply too complicated, and that we really need to think about a systems biology approach. This is just also illustrates the commitment of the Commission and the European Union to deal practically with the issue of combined effects of mixtures. So again, the Commission has to come up by 2013 with guidance on how to really tackle this risk assessment and ultimately risk management of mixtures and combined effects across the different regulatory areas. But basically, this is an extract from a recent Commission communication on this, and it only came out a few days ago, so you can read about what the Commission intends to do in the next couple of years. And very quickly, no surprise, it simply states that we don't have enough knowledge about exposure. And we don't have enough knowledge about mode of action. But again, in all of these communications, the concept of mode of action and the acknowledgement that we need to use mode of action reasoning to tackle these issues, it's already embedded in our legislation and in our strategy. So the question is not if, but how are we going to do this? Again this week, the Council of Environment Ministers met and reinforced their commitment to addressing the endocrine issues and mixtures in the next Environmental Action Programme. So all of these discussions, of course, are, well, we must adopt a science-based approach. Well, easier said than done, and I don't think we're all on the same page as what we mean by science-based approaches. And so, from my perspective, however, this is where the key role for systems toxicology comes in. There are certain problems now that we're facing where we simply can't do it with the traditional approaches. So, it's the right time, the right place. So let's talk about paradigm shifting. So I was at a conference one day. Somebody actually asked me, had my paradigm shifted? And I thought I was actually standing funny or something, or, had I joined some religious cult. But so people are deadly serious about this. But it made me think a lot about, God, I wanted to say yes, but I wasn't exactly sure what I was saying yes to. So I'm trying to do it in a real kindergarten kind of way of trying to, it's more for my own benefit than yours almost, to try to explain what I think this paradigm shift is all about. So we all want change, but change. So let's look at this. Derek, my good colleague, talked about information requirements for risk assessment, and it's the recurring phraseology used in REACH, information requirements. But you know, information can be anything really, can't it? It can be data and it can be knowledge. So this is our paradigm spectrum. And on one side, I'd say we have the data-driven paradigm. So this is where the information comprises mainly of data. And the nature of this paradigm, let's say in simplistic terms, is that it's based on observation. You don't actually kind of need to know anything. You have to measure to decide. Okay? And it's very data hungry. You need to measure for every possible effect. So let's go right to the other end of the spectrum, a knowledge-driven paradigm. Here, the concept is based on understanding, that you predict to decide, and hopefully it's very data efficient. So you only really generate the data that you think you need. So there the two ends are. Now, of course, you know, depending on the case, you could be at either end. But I think for me, we need to shift from here over to here. And that's a big ask. I'll give you an example how that, for me, how it should manifest itself. So again, Evan set the challenge. You could come here and give case studies and so on. Well, I haven't got one to give, but I'll tell you how I think I'd like to see where the evidence will lie that we've shifted our paradigm. So I went on Derek's website, and you go there, and you know we have a program for looking at substances of very high concern. And basically there's a system called the CORAP system, where member states or the Commission would ask ECHA to look specifically at certain chemicals that they think are of high concern. Basically what happens is that a dossier is put together, submitted by a member state, and then they decide if a detailed risk assessment needs to be done and who will do it. But if you go there, and I was browsing, this was a couple of years ago now, and I pulled up this one. Don't ask me why I picked boric acid. I don't know anything about boric acid. I have nothing against it or for it, as they say. But basically, I looked at this, and I was actually looking for reference chemicals that I could use in a validation study. But anyway, it's another story. And I started reading it, and it's laid out this. And I'm sure there's plenty of documents like this over here in different regulatory contexts. And I went to I said, great, let's go down to human health hazards. So I read through it. And sure enough, plenty of tables about NOELs and Lowell's and so on. But I read it twice, and I still haven't the foggiest idea how boric acid has any adverse effect. You'd have to really be in the know. So, if this is the kind of, for me, the stark kind of evidence that in discussing potential hazard or risk, that really it's not evident that we're using all the knowledge we have. We're using a lot of data, but I'm not sure much of it. So I'd like to see this type of document and what it should look like in 10 years' time. How should the arguments be put forward in terms of its basic reactivity profile, the type of initiating events it could trigger, what those initiating events might lead to, as she talked about. So, that's what will set a challenge for us all. Could we rewrite that document based on knowledge? So let's talk about models, because models are very important for all of this. And I mean models in a general sense. So if we go back to our data aspect, well, the models used in our data-driven approach could be described as needing to be close to reality. Ideally you'd use a human as your model for a human, wouldn't you? If you don't know anything. They're empirical, of course, have to be, and typically they'll be animal. And they're holistic in the sense that they need to be representative of the whole system, because you couldn't substructure it because you don't know what's important and what's not. And they're fixed. So years go by, you finally find this kind of correlation, and then you go, okay, that's it now. It has to be 28 days. For God's sake, don't do a 35-day because I'm lost, okay? And this is the other extreme, knowledge-driven. This is where we want to go for me. Well, the models will be abstracts of reality. They still could be physical models, but they couldn't be mathematical as well, because that's the pure abstraction of what we understand. And hopefully they'll be modular and flexible. And I mean modular they'll still be reductionist, but they'll be reductionist in an optimal way, so that you don't lose essential systemic qualities, and then drop your ability to observe that emergence, I think, that Kim talked about earlier. So, going back to my shifting paradigm, and the question was asked to me, I think, well, actually, it was a good analogy, because paradigm shifting does hurt, and if it doesn't hurt, we're not shifting, okay? And I liked a lot of Kim's analogies earlier on about, it should be, let's say, a rapid evolution rather than a revolution. But it also hurts the wallet, and most important, it's going to hurt tradition. Now, you see, I empathise very much with Shihei, because I'm actually a bioengineer. I don't have the burden that a lot of you have of 35 years in the field. So, but I'm really trying to empathise and appreciate that this is a break with tradition, not just at the scientific level, but also at the regulatory level. So let's talk about capturing this knowledge that we need to shift to a knowledge-based paradigm. So you haven't got the knowledge, you're not going to have much of a paradigm, are you? And it's funny, I was looking for, just to make the slide a bit interesting, Google Images, knowledge, show me a thing. And I came up this, the tree of knowledge, said, well, that's interesting, isn't it? Said that apple was probably the most toxic substance known to the human race, And what about a low-dose effect? These two characters eat one apple, and a whole race is doomed for eternity, And I'd also venture it might be an epigenetic effect, is it? So, I made me laugh on the plane coming over. So I'm talking about modern action theory. When I was trained in engineering and physics, we did experiment, we did theory, and we did computation simulation all together. My PhD thesis has 3 equal parts to that. So I found it fascinating to get into this field about 10 years ago, where there was kind of no books on theory. There was lots of, So I call this mode of action theory. It's a theory of toxicology, really. And, I came across this, and I was a bit lost, when I started coming into the field, because I literally couldn't get distilled information or knowledge about certain processes. Cell apoptosis, that's an easy one, 80,000 hits, oh my God, So either it's incredibly complicated, or these people don't know really how, aren't very good at communicating what they know about it. So this guy's quite smart, and he basically said, this is now a crisis, gone beyond the desire, in that unstructured information doesn't enhance our understanding. He's calling for a framework to be able to organize this information into a knowledge framework. Now, that doesn't mean that we have to generate new knowledge. It means that there's potentially all the knowledge is there. It's just that we haven't really organized it well so we can exploit it. There's tons of these things. We've been spending quite a few years now trying to construct modes of action and adverse outcome pathways. And, none of this is wrong. But it's very subjective in lots of different levels. Knowledge is subjective, but the way it's illustrated is subjective, and so on. Here's a good example. This is actually a very good paper. I like it a lot. But, obviously this guy's world is the mitochondrion, because he puts it right in the middle of his, So, as I said, it's not wrong. And these are all shown. Now, as an engineer, I look at these, they say, well, that's kind of informative. I said, but you're not telling me everything I need to know. You're telling me who the actors in the story are, in the sense of these nodes, and you're telling me that they're somehow related. But you're not telling me how they're related and how they interact. The whole dynamic is missing here for me. So, these are interesting, and they're definitely pretty, but I'm not sure ultimately how useful they are. So that's why this thing came up, And I'm not going to get hung up, and I'm glad Kim isn't getting hung up either on this, what's one or the other. But at the conceptual level, these things are all the same. It's about telling a story, isn't it? It's about telling a story from the molecular event upwards. And where you stop and where you start, well, it's very context dependent, isn't it? But these things are different from the context in which they were developed. And that's why they're discussed differently. And they should be discussed differently, because mode of action arose out of really a desire to reconcile all of the predominantly animal data and tell a story about toxicity. Whereas adverse outcome pathway came very much from the QSAR type community. And toxicity pathways, of course, came from the NRC consideration. But all of those merged together, I think, gives us a great body of knowledge. So I decided to try to dig into this with Mel Anderson, and we organised a workshop in September last. Very simple questions, but very loaded questions, and I know some of you were actually there. And we wanted to delve a bit deeper into, if we're developing this theory, before we ever try to apply it, what does this theory actually look like? And a lot of learned people there, and I said some of you will recognise yourselves in Eastborough. And I've just taken the first question. Now, we've a long-awaited report coming out, I hope, very soon, and Mel and myself are writing a commentary, so I'll be able to give you this. But I'm going to go through these very quickly, because they're just going to give you a little flavour about we're developing a theory together, what's important. Well, you know who contributed that comment anyway, because it was talked about before. We need terminology. We can't talk to each other. We discussed the issue about, well, look, in terms of the biological domain that we're covering, toxicity pathways tend to be more at the molecular cellular level. Sorry, I'm looking this way because I haven't got my glasses. So this was a point about, look, it's just normal biology gone wrong. But the context is very important. You can't talk about the toxicity pathway if you don't mention about dose, site, time, life stage, etc. The adversity, so some of these things were dealt with later, so I won't dwell on them. And this came up, look, if we can't define it, at least we can kind of talk about attributes. What characteristic would a pathway have? And most importantly, what isn't a pathway? That was important. The acknowledgement was that, look, do we really need to get hung up in really defining this? But actually the counter-argument is, well, if you want to use it in regulation, you better think about probably defining it better. This is an interesting one, and Kim had a very courageous, I think, effort to answer this, but I'm not sure if the answer is still clear to me. I call this the paradox, in the sense that we have a vision of only going to the cellular phenotype and then, predicting regions of safety. But to be able to do that and convince regulators, etc., you have to go all the way. So I'm still sitting on the fence here because I haven't understood fully. But I think it is something that we need to talk about. I put in this bullet because it's important when you're developing your own theories to make sure that that you're listening to other people who have totally different views. So this came from a guy who's a master of his art, but the pure informatician. Give me descriptors, give me lots of descriptors, give me the data, and I'll give you the prediction. So his idea of a pathway was that basically, look, these are just patterns, they're motifs. We don't really need to understand why, but the way I do it, I could probably then match up one chemical with another and say it's probably going to be a carcinogen just based on the toxicogenomic response or whatever. And so that was an interesting view on the world. I would say, though, very based very much again on observation, but it's important to consider things. Let me just scroll through these. I don't want to use too much time. And there's something that Kim talked about. That actually, we shouldn't forget the use context of these things. Toxicokinetics was very much acknowledged. We need to come up with a better nomenclature. If I'm talking about a pathway, don't keep telling me about the starting point. Oh, I'm doing ER. You say, well, ER is ER. You're starting at ER, but where are you going to end up? So this was something to consider. And let me hear, the last one was a grand plan. How are we going to systematically mine this knowledge and manage it? So I just want to acknowledge here too, I was first inspired to follow this mode of action kind of route. Actually, it was at a mode of action workshop given by the IPCS at the OECD a number of years ago. And there's plenty of knowledge there, but I won't go into it. But, how to use mode of action in regulatory decision making is very much described by those publications. So, if we're thinking about needing this framework, okay, and we're thinking about a grand plan, well, a very good place to start is the OECD, because we're all members of the member countries of the OECD. And myself and Bob Kavlik are chairing the extended advisor group on molecular screening and toxicogenomics, which is quite very much a scientific discussion forum up to now, but has been given the responsibility to now manage the program at OECD on adverse outcome pathways. Now, I'm using mode of action and adverse outcome pathway interchangeably. I'm not going to hang up on. And we had a meeting just last week. And And these are the clients of the AOPP. So again, I'm not going to give you case studies, but I want you to illustrate where this AOP work is going. The first is supporting the Hazard Assessment Task Force. This is a group working on methodologies for grouping and read across. They're going to have a new program, integrated approaches to assessment testing, the ITS type concept, so within a regulatory context. The test guidelines program, obviously developing new test guidelines, particularly hopefully around alternative approaches. The QSAR toolbox that Shia mentioned a lot and gave a very nice illustration there. And then, of course, external programs and organizations. And this is how our projects are defined, mainly around AOP development. Okay. Now, again, I say this is about harvesting knowledge and putting it into a usable framework. It's not, and people are saying, sure, you only just read that review paper and took, that's the point. Most of this knowledge is being just repackaged, but into a way where it's much more usable in a regulatory context. Okay, and then hopefully we'll identify some gaps too. And also, recently there's some draft guidance that's come out that describes what an AOP is, how you describe it, and most importantly, how you provide evidence to back up your postulations. I won't go into this, but key things are it starts at a molecular level and goes then to a second anchor. I wanted to throw in this because of the word linearity. As an engineer and a physicist, linearity means a lot of things for me, and I think for others it means something else. But, along a line, I think, is what people mean. And I just want to illustrate, that's for illustration purposes, let's say. But this is something I knocked up very, very, quickly with the help of a colleague. But this is the idea that, we have events that are happening at different levels, triggering other events. But importantly, do you see, events at a higher level can trigger events at a lower level, and so on. In this case, this is actually an event happening at an individual that potentially is triggering something. And what's important here is to look at the horizontal axis, where the story is evolving at every level. It's not that something happens here and that's it, that your genome is done at that point. I mean, that's not true, is it? All of these things are evolving. So depending on what plane you're in, you can tell the story at each level, depending on the time, depending on the dose, ultimately describing the pathogenesis. So, what's important here is that, we can be observing things that aren't critical. They're not key. They're symptomatic. Or we can describe things that are really key, and they're the things we might want to measure. So this is just to give you an illustration that the concepts are evolving, and we shouldn't get hung up on this linearity thing. This is important because, not just because skin sensitization is important, as Derek was mentioning, but what this represents to me is the first time the regulatory community internationally have agreed on knowledge. This isn't a test guideline. It's not a method. All these people came together and said, listen, this is how skin sensitization happens. And everybody agreed in it. I think that's fascinating. So I think it's the first time I've ever heard anything like that in the regulatory context. So now you've got agreement on the how and the why. The next time you go back to the same people, you say, listen, you remember we had that discussion on skin sensor? Oh, yeah, I know the key events. I know how that all works. Yeah, we all agreed on that, didn't we? Yeah. Okay, here's a test system now that will follow that logic. I expect a hell of a lot of more efficient way of people accepting different ways now of implementing that because you've agreed on the knowledge first. Okay? So that's the theory. We've agreed on the theory. So this is at ECFM how we're beginning to put that into practice. And I didn't mind us being a guinea pig. I want ECFM to be progressive in this area because we're overwhelmed with people submitting methods going, will you validate my method? It's one little in vitro assay. And then you ask them, well, how would you use it in a regulatory, a hazard assessment context? I don't know. You're ECFM, you tell me. I'm just a scientist, And the thing is, that was fine 10 years ago when there was only a handful of methods around. But now there's every PhD student can genetically engineer a cell and have a report or gene. So we need a better way. So we need to look at relevance up front of the information that's provided by these assays. And this is an example how AOP gives you that, because the AOP, in a sense, is the theoretical backbone. So it allows us to begin to group methods that we have in validation or coming in for validation. Or better yet, I've got key events here that I've got no method at all. So from my perspective is, I'm actually going to say to people, listen, for God's sake, will you stop sending me methods for this key event? I have enough. What I need, though, is I need methods here and here, because otherwise I can't the picture, okay? So just to get a little flavour about what we're trying to do now in terms of practically applying this knowledge. So go a step further. I mentioned before mathematics is kind of a language that was fundamental to my training. And I call it language of function. When you want to begin to describe how things function, how they oscillate, how they switch, you need to start using, if you try to use just in a narrative, you'll be there forever. And maybe that's why we have thousands of papers describing what actually could be described very simply using a different language. And I wanted to stick this in because what's key for me here is that we have to get away from this idea that that's for a couple of backroom boffins. They're the modelers, shovel in a bit of data and then, they come up with something. It's the people who are in the biology areas and so on that need to begin to appreciate this. And this was a training course we ran where most of the people in that picture, actually there's a lot more that were gone to lunch, actually aren't modeler. They say, oh, I'm not a modeler. Oh, mathematical, God, gee, that was like back in school. They were exactly the people we needed to train. And having Mel there to do it, of course, with his charismatic way, was a great way of getting people involved. But ultimately it was about this. It was about trying to understand real linearity and non-linearity, what do we mean in terms of functional dynamics? Because it's critically important for stem cell differentiation, for endocrine disruption. These are all hypersensitive, non-linear effects that you need to discuss with each other, and you need equations to do it. And this is the type of functional now, albeit graphical language, that we need to begin to use. That this type of U-shaped behaviour, or oscillatory behaviour, or bistability, jumping from one situation to another, these are the functional dynamical motifs we need to begin to use. But modelling isn't just about prediction either. That's another misnomer. We all build a model so we can predict. No, models are a lot more important than that. We need to use models to organise this disparate information. It forces us to think logically about the components in the systems and the interactions. It's like, for me, putting all your cards on the table. What you really understand about that system. And, you don't have to be super quantitatively either. Yeah, sure, maybe it's not calibrated fully and it doesn't exactly, but just by looking at the way it behaves can tell you a lot about what's important and what's not, and what to expect, and to find the unexpected. Really shifting paradigm, breaking conventional wisdom, and hopefully then to discover new strategies about how we actually can do safety assessment without using animals, for example. So let me just finish now by giving you a little flavour about some of the ways we're trying to really bring this to bear and hopefully produce some concrete results. Derek mentioned this. I'm heavily involved in the coordination of SURAT, and yeah, it's a big project, but it's important for a whole lot of reasons. Practically, it's a public-private partnership, etc., etc. But this is what's important for me. It was at the beginning we said, right, look, stop. We've got 5 years. We need to get on the same page when it comes to our research strategy. Not about our toolboxes and our what cell have you got and so. Let's think now strategically, okay, for once, and not in year 5. And so we all signed up to this statement that's in our first book, next to our vision, and it explicitly talks about using mode of action framework to describe how any substance adversely affects human health, and use this knowledge to develop complementary theoretical, computational, and experimental models that predict quantitative. So there it is. If you're in SURAT, you're signing up to that. And whatever you do needs to be influenced by that statement, or most importantly, you need to contribute to this statement, okay? So it's, again, hardwired into the concepts that we've defined at the cluster level, not individual projects or work packages, but at the cluster level. And the first one is our concepts at 3 levels. And we've explicitly said, to show that this project actually works, we want to actually demonstrate, purely at the theoretical level, how you go about harvesting the knowledge you need, and then reconciling it and then explicitly describing that knowledge in a mode of action way. And you do it because you want to then do it in a way that somebody could use that. So again, this is it's not just airy-fairy thing. It's saying do it in a way that somebody then can take it off you and do something useful with it. And they'll do that, but then they'll use it to build systems, integrated systems that are purpose-driven. And then eventually show ultimately then how you can use this in a safety assessment context. And Derek is involved in this, and not only is he involved at the scientific expert panel, but he's also involved in co-leading our working group on safety assessment, because we wanted to have these things established up front so we can set the use cases up immediately and then see. So I hope, I know this is very aspirational, but if you read the second book, which will be coming out in July, it'll tell you how we're getting there. And these are the type of this purpose-driven approach we want to. It's not about saying, oh, I have a lovely, derived stem cell model, looks very in vivo typic, could be good for... We want to get away from that. We want to say, right, what is the mode of action that you're interested in? What are the key processes, mechanisms that we need to capture? Right, now what's the type of model are we going... Could we do that with a computational tool? No, maybe we need an in vitro... Okay, what in vitro model would be best for that? And then you go and look. And by the way, a 3T3 fibroblast might just do the job grand if you're interested in disrupting membranes. Maybe you don't need, $1 million stem cell. I have a stem cell research group in my unit, by the way, so I'm well aware of the discussions that one has. So here's a kind of list of example purposes that we're trying to get people to focus on up front. And it goes right from the kind of reactivity profiling down to quantitative prediction. And another big change in this has been the selection of chemicals. And now, for those of you who've ever been involved in validation studies or even research studies, the selection of reference chemicals seems like such an innocent endeavour, but it ends up being where people fall out. And there are two sides of the story here. One, you can pick them from a very empirical, traditional way. Well, this is about cosmetics, isn't it? Let's pick cosmetic ingredients. Okay? Or you can say, no, enough with that. This is all about molecules. It's all about structure activity. It's all about mode of action. So before we pick any chemical, let's explicitly state what modes of action we're interested in, because that will define our domain of biology. And then we look for chemicals that make sense to use in that context. So it's no point looking at these in great detail, but the first part of the chemical selection was not to select chemicals at all. It was to actually understand what modes of action were relevant for repeat dose systemic toxicity, try to zoom down to a reasonable level of what's happening at the different levels of biological organization, and then begin to pick what we call pathway control chemicals. So again, the process of selecting these chemicals, I think, is a very clear illustration of adopting this type of mode of action driven strategy. And again, I won't go into that. This is a very, very modest example of beginning to apply that then practically in that program. This is actually from my own lab, where we use high throughput screening. Well, it's actually high content imaging in this context. But what you're all basically seeing here is the emergence of a strategy to group chemicals. So the purpose here was to group chemicals based on their biological activity with assays that were selected with their association with prescribed modes of action. Okay? This isn't a brilliant example because some of the assays we wanted we didn't have, and so on. So it's an iterative process. But the thinking is very different when you say at the start, you say, listen, that's my design strategy for this. So these are the type of tools that will begin to emerge. Derek mentioned the two books, I'll say no more. So just to conclude, going forward, I think we need this framework for knowledge, but knowledge that can be used in regulatory safety assessment. That's why we're doing this. And I think we do have the platforms that we can exploit. So I do think we need to come together to do this and not reinvent the wheel organizationally, let's say, make sure that we're all together. And we hope, Bob and myself in the OECD, that could be a focal point for defining the processes of how we harvest this knowledge and hopefully warehousing this knowledge in practical IT systems. Please go and have a look at the OECD guidance, go to the website, and also keep in mind that this advisory group isn't a secret club or some special membership. There are representatives there representing all of us there. So it's about really integrating with external activities. We need to emphasize the need to understand and not to measure. We have spent billions in Europe generating data. If Horizon 2020 turns into another funding program where we're going to fund labs to generate another mountain of data, we're in trouble. We need to fund understanding, and I heard from Derek from the Accelerate project that I'm co-chair of the scientific committee in that as well. But they're a call for funding knowledge projects. That's exciting. We need the data, but it can't be the only part. We need to define research strategies based on mode of action. And when you sit down and really try to do that, you'll do things very differently. And I like the idea of case studies, and I like that, particularly in the next-gen approach in that sense. But we need more of them. And they're not only great tools for understanding how well we're doing, but also they're great tools for communicating, ultimately, the limitations and the usefulness of this. So thank you very much.
Well, Maurice, thank you very much. While we're getting people to the microphones, let me start and ask a question on the adverse outcome pathway, which is kind of related to some of these that we've challenged you with. So I think it's absolutely marvelous that now we're starting to think about assays as they kind of fill along the way of the adverse outcome pathway, rather than just what assays are out there and let's just go screen it. But now, what is the strategy then to integrate information or data that will be generated from those assays into that knowledge that we need? I think it's good that the strategy is moving towards linear alignment of the assays for a particular question. But now, what do we do with data from those individual assays?
But that's a great question, and something that I've left out of my presentation. But we're developing. Well, I don't know how many of you are aware, but the OECD developed many years ago OECD harmonized templates for reporting on property of chemicals. There are about 80-something of these templates, which are predominantly for reporting phys-chem properties and also hazard data generated on in vivo animals. But it's an expanding data model. It's not an IT platform. They're templates. And actually, this is the basis for Euclid. And what we're doing at the moment is developing a new template for what we call reporting on intermediate effects. So if you have a AOP and you've identified key events and you have assays that are matched to those events, you want to be able to report the data against those events, either in the initial stage of AOP development where you're providing evidence that this causal link is there, or later on when the AOP is established and you want to actually report data on your chemical against that AOP. Again, you'll need that template. So that's something we'll be rolling out I hope in the next few months to a kind of limited audience to get it proof tested, but ultimately that will be, let's say, I hope an international standard for reporting data from those assays. But this is for reporting on intermediate effects using any type of method. So it's not restricted to in vitro, but will also be for reporting data from effects data from also that's derived from a read across or from a prediction model.
Maurice, let me follow with a question from our online listeners, from Michael DeLarco. He's asking, so what is really what would be the effort to develop a system approach to investigate cellular networks and coordinate that information into the in vivo condition, right? Not just simply, aggregate data from these assays, but actually put this into networks and then ultimately try to be predictive of the actual apical endpoint.
Yeah, that's a terrifically valid question. I mean, again, we're using AOP and so on. They're just words with labels we're using at the moment. But let's focus on the concepts. And the concept here is if you look what I showed, which is a kind of a little elaboration of the AOP, where it's not just this kind of linear thing. Because you look at that and say, oh, listen, biology is a network. Why are you, if you're, and people walk away straight away. But I like to think a bit like kind of like Google Earth, where if you zoom way up. And if you ask me, listen, how do you get from Milan to Rome? The road looks very, one road and that's it. All the roads lead to Rome. But if I zoom down, I realize that there are many ways of getting to Rome. Okay, so the issue here is that, and each layer should be obviously compatible with the other. So the use case is extremely important. So to answer the gentleman's question, network philosophy and theory is intimately embedded in this, even though to communicate with regulators in particular, this is simplified in that way. But conceptually, underlying that is the idea of network, but not just network at the molecular level. And this is where we're falling over. You know, we all get obsessed with inferring networks at the molecular level because I can measure all of those things. You know, that is definitely looking under the lamppost. You know, but almost probably more important is the network that links the different layers of biological organization. So multi-scale modeling, if you want to use that terminology. So it's definitely network, but it's selective modeling. And also, by the way, you know, I keep kind of try to hammer this home. This is for purpose we're doing this. This is for making better regulatory decisions about hazard and hopefully risk. But you know, it's not about understanding all biology and mapping every possible event. I'm not in that club, okay? But it's about distilling out what we need, okay? So I hope that answers the network question.
Dr. Guyton?
Great. Thank you. Thank you so much. It's a very interesting talk, Kate Guyton from EPA. Really, really interesting, this discussion about linking to apical endpoints. And just in terms of your mode of action concept, are you really thinking about an apical endpoint in an experimental animal, or you're more thinking on the human disease side? And let me just provide a little context, and maybe the question is the context, because certainly at EPA we're concerned about a lot of chemicals. I think you heard from Isla, things like benzene, where I'm not exactly certain what's the mode of action pathway from chemical to disease. And if we think of other known carcinogens like cigarette smoke, I think we don't really know how they go from A to B to C to D. So really the question is, what's the apical endpoint and the context for that? Are you really thinking human disease, and how do we deal with these chemicals that we know have very complex effects, and how would we identify them from this type of system? Thanks.
Yeah, a very, very relevant question. And I'll bravely try to answer it, but it's definitely an emerging theory. The important thing here is to have an anchor at both ends, okay? Mm-hmm. So if you're, in the question you're asking, are the access to type of investigatory tools that you have mean that you want to put the anchor at the tissue level, or it's in an animal, then you choose. This is a crowdsourcing exercise, okay? So now, of course, we're interested in human health, and we're into human health risk assessment, and therefore those anchors, you know, have to be in some place relevant for us to extrapolate. But so as a knowledge management and organizational exercise, we're not at the moment saying you must put your anchor here, okay? However, part of this philosophy also is a very strong look at what we call comparative toxicology. So in the group, we have a subgroup called comparative toxicology that is looking more not on really elucidating in great detail lots of pathways, but actually looking at the conservation of pathways across species. And so there is an emphasis where the relevance then becomes, you know, extremely important. So for endocrine system, for example, here we know we have high conservation, and therefore, and this opens up the idea of, you know, one of the catchphrases in one of our early meetings is, you know, will we ever use Daphnia results to inform on human health risk assessment? You know, because the concept there is that, well, if that model is capturing a particular mechanism that you know belongs to that mode of action, which you know is relevant for a human, why not? You know, and vice versa. So the other point I'd make too is that I honestly don't know if this will succeed. To be, you know, all I can do as a scientist is get on the right trajectory, I hope, and see as things. I'm already, however, beginning to see low-hanging fruit. In AgFam, I can begin to use science to prioritize the next in vitro assay I validate. That's good for me, you know. But the question one of the key questions will be is how much resolution, how much detail will you have to go to describe an AOP so that it becomes useful in predictive sense? And therefore your question is kind of in that domain where I don't know yet how deep we'll have to go into things. But, everything is relative, isn't it? Because we'd be foolish to stumble already on being worried about this possibility of having to get into great detail. Let's look at our starting point. I'll go back to Sidney Bremer's comment. I mean, it's a mess. I mean, there's knowledge area is all over the place. So even just getting, let's say, lower resolution, knowledge in place, and then identifying, beginning to ask the question, how relevant is this? And the issue of validation comes up too, but validation in a very broad sense, So I think I've successfully dodged a question there now, so I'll stop.
Yeah, thanks anyway, that was good.
Let's go to the next question.
Hi, Rita Shoney, also of the US EPA. And I don't have a question. And instead, what I would like to do is leap up on the stage and lead the cheers. I think that what you were presenting today has made more sense than just about anything I've heard in a very long time. And speaks, I think, to my agency, certainly on a number of different levels. We are drowning in data, and we desperately need information, and I'd say even more than that, we require knowledge to be able to make the links between data from high-throughput assays, data on apical endpoints. If we are going to make some sense of this, I do believe that as risk assessors and particularly as regulators, we need to embrace concepts of adverse outcome pathways, mode of action, toxicity pathways, all of these pieces. It's not an add-on. I think it's absolutely essential for us to be able to move ahead in an increasingly complex world to try to do some things that are going to be appropriate. So again, I just want to thank you very much for giving that particular presentation, and I'm looking forward to the rest of the session.
Thank you, Rita. Dr. Jones?
Yes, well, thank you.
Thank you very much for your generous comments.
I don't know whether this is on, but I enjoyed your presentation as well, but I'm going to be the counterpoint. Because from the standpoint, I spend my life trying to figure out better ways to capture more data in a more consistent manner. And from my standpoint, without the data, what criteria do you use to discriminate what you know from what you think you know?
Super. No theory is ever going to stand up unless you throw rocks at it. So this is all good. How I'd answer that, if I think I understand where you're coming from. Let's not confuse, and this is something where, in particular, talking to sometimes the regulatory community and possibly industry community is, let's not confuse the discovery and the first part of this exercise in mapping the knowledge and capturing it explicitly, okay, from then how we apply that. Okay, so for example, there's a misnomer sometimes that people say, oh my God, for every chemical I'm going to have to describe to the nth degree about everything. That's missing the point completely. There's a very strong philosophy underpinning this, and you can buy into it or not, which is that at a certain, let's say, lower resolution, you can begin to group chemicals and associate them with generic modes of action. Okay? So at the highest level of resolution, so I remember I Google and I go zoom right down, every chemical is different. There'll be something subtly different toxicokinetically, toxicodynamically. But as you begin to zoom out, you can begin to bin. So this grouping and read across and so on is fundamentally underpinning all of this. So in that sense, the idea is you need to generate lots of data initially, or hopefully harvest existing data that you have in a targeted way to describe that AOP once. Okay? And you typically do that with a model compound. Verapamil. Verapamil for me represents a certain pathway, and there's tons of data. And by the way, I don't care if it's a pharmaceutical, or I don't care if it's industrial, whatever I've got a lot of information is. But you pick your model chemical, and for you, then that helps you describe. But once you've done that, the underlying assumption is that there are other chemicals, other molecules out there that follow that pathway. So I would agree that in the initial stages, the data that you need, the information that you need to A, postulate, elucidate the pathway in the first place, and B, very importantly, provide enough evidence that your postulations are robust, is very intensive, potentially. Okay? But once done, it's done. Okay? Because at that point you say, for a chemical to be for any other chemical X, to be associated with that AOP, it must, you've identified key events that are essential, but not necessarily sufficient on their own, if you know what I mean. So I've got a range of things that have to happen for this chemical to be associated with that pathway. And then the type of testing I need to do then is far more targeted and far more restrictive. Okay, so initial phase, I need to do a lot. But once I've got the AOP, it's done. I agree on it. Now the next step is to, if I want to see if my chemical, another chemical is associated with that pathway, I only need to generate a very, very little amount of data. The extreme being, which is a QSAR dream, is that if by lo and behold lots of AOPs were intrinsically linked to molecular initiating events that were sufficient and necessary, okay, then all you'd have to do is build a QSAR for predicting that, and you're done, because you know the rest. So take the skin sensitization, for example. Haptenation, peptide binding. If that was sufficient and necessary, necessary and sufficient, I should be saying, then you're done. Because you spent years figuring out that has to happen. And if it doesn't happen, there's no way that apical endpoint's going to happen. So there's your test strategy. It can be a computational prediction. But in another case, if you say, well, with all the evidence I have, haptenation happens, then it begins to migrate, but there are plenty of evidence that that's not enough, and dendritic cell activation relies on other factors. Well, okay, now that's not enough anymore. You need that piece of the puzzle. Did you notice, too, with that, it's a tremendous framework for weight of evidence? Because we talk a lot about weight of evidence, but actually there's not very many systematic ways of doing it, But if you want a science-based weight of evidence approach, there's your AOP. Start filling those boxes with evidence. So I hope that's answered your question, where it's a lot of possibly data-intensive, data-hungry at the beginning to understand the AOP and describe it, but once it's done, it's done. And then your eventual information requirements, we hope, would be very, very low.
John, last question.
John Ballas with NIEHS. I want to add the praise to the presentation, which was really nice and clear, and the work that's being done behind it. I have a comment question that may be a corollary of that last question, and it has to do with distinguishing between the conceptual framework upon which you're basing the use and application and interpretation of the data from the ontology and the framework upon which you would construct your data sets. And I would submit that using AOP in the former as something to base the conceptual framework for analysis and predictive toxicology makes sense, but it may not be the best thing to actually construct your data set on, because I would submit that AOPs are probably not as fixed over the time period that we're going to want to be collecting data. They are a construct. They're not discrete. They overlap. And they're probably going to evolve, and we certainly don't have all the AOPs we need yet to describe all of the endpoints that we know of. So as you think about, the knowledge management, which you raised, I was hearing maybe organizing it on AOPs, and I would just raise a question as to whether that is a long-term good thing.
Maurice, let me maybe punt this to the session tomorrow, that we'll have a round table just for the sake of time. I think it's a great comment, but I think it does relate to what we'll talk about tomorrow in the round table. Thanks again, and let's give another round of applause to Maurice.